Just explain to us, Will, what's the sort of justification, we've just had a bit from Sophie's package there, as to why the people you've been speaking to today have said, we're not going to come to work?
Good morning. Yes, well, this is a really busy road in and out of Nottingham. It's the ring road, so that's why the divisional headquarters for the East Midlands Ambulance Service is here in Nottingham. You can see over one of my shoulders that there are a number of ambulance crews that are on strike today. They are on the picket line. East Midlands Ambulance Service that operates the ambulances here in Nottinghamshire, in places like Lincolnshire, Derbyshire, Leicestershire. They say that they estimate around 50% of their workforce could be on strike today. They're members from the GMB union, where 10,000 or so members across the country are on strike today. They're not going to work. One of the justifications that I've heard is that while obviously a big part of it is pay, it's about that 4% that the NHS would like to see it increased, whether it's nurses or ambulance workers. But the other thing is really about conditions. I was speaking to one gentleman who didn't want to appear on camera, who said that even before the strike, he was waiting 5 hours at the local hospital to dispatch his patients that were inside of his ambulance. Those waiting times are the real key thing. He added to me as well that I know people are saying that people are going to die today, but people are already dying because of the conditions. And so while obviously a big part of it is of course pay, the other really big one is the state of the NHS, when right now there are 130,000 vacancies inside of the NHS, so that's across the health service, but also at a time when different trusts, including the one here in Nottingham University Hospitals, are declaring critical incidents. I think it's 5 as of the last time I looked. 5 ambulance trusts have declared critical incidents because of what's going on, because of the state of the NHS, and also, of course, because of the effect of these strikes in particular. Just to give you that overview, it's probably easier to say where strikes aren't happening today. So you're not going to have strikes in Northern Ireland, you're not going to have strikes in Scotland. You will see ambulance strikes in Wales and every region apart from the east of England, inside of England. And the real key message, though, from the NHS and the ambulance services, if you do have a life-threatening emergency, cardiac arrest, a stroke or sepsis, do get in touch via 999. But if there is a lesser emergency, 111 is your safest bet, or going to the urgent treatment centres where you can just walk in and hopefully get seen as quickly as you can.